Good morning. My name is Felucia Ademoyewa. I'm a medical oncologist and I practice in a large tertiary academic institution in St. Louis. I thought I would do these videos approximately once every other week just to educate the lay public about breast cancer because I believe there are a lot of misconceptions about breast cancer. People don't really have a good understanding about the risk factors for breast cancer and what they can do to prevent the disease, and also how to seek medical opinions as well as second opinions. So to get started, for the first video, I thought I would just sort of introduce what breast cancer is, talk about the epidemiology of the disease, so the statistics about breast cancer, the risk factors, and preventive lifestyle measures that an individual can do to decrease their risk of developing breast cancer. So to start with, first, what is breast cancer? Well, breast cancer is simply, in very simple terms, a cancer that started in the breast, in either the left or the right breast, or a cancer that started in the lymph nodes in either the left or the right armpit. There are five stages of breast cancer, but four stages of invasive breast cancer. So stage 0 is what we call non-invasive breast cancer, and that is when the breast cancer cells are still located in the lining of the milk duct, haven't broken through the milk duct, and since they haven't broken through the milk duct, they don't have the tendency to spread to other parts of the body and therefore are not lethal. Stage 0 cancer is really never treated with chemotherapy because it doesn't have the potential to kill. The other stages of invasive breast cancer, or all the stages of invasive breast cancer, I should say, are stages 1, 2, 3, and 4. In general, stage 4 breast cancer is when it has spread to a different organ, so has spread outside the breast or armpit area. And usually, if breast cancer spreads, it usually goes to the liver, the lungs, the bones, or the brain, or the skin, or the lymph nodes anywhere in the body. In general, that stage of breast cancer is not curable, but definitely manageable with new medications that we have in 2017. Stage 1 breast cancer is when the breast cancer is very small, so it's under an inch in size and still located in the breast and hasn't moved to the armpit area. Stages 2 and 3 breast cancer is if the breast cancer is about an inch or larger in size and perhaps has also moved to the lymph nodes in the armpit. Stages 1, 2, and 3 are fully curable with proper treatment. And as I said previously, stage 4 breast cancer is usually not curable except in a very small set of patients. And so really the goal for stage 4 breast cancer patients is to keep the disease under control, hopefully to prevent symptoms from breast cancer, as well as to extend the length of one's life. So what are the statistics for breast cancer? Well, breast cancer occurs in about 250,000 women each year in the United States. So that's about 250,000, which is a huge number, and accounts for about 40 to 50,000 deaths per year in the United States, and is the leading cause, or is the second leading cause of deaths from cancer in United States women, second only to lung cancer. So it's really a huge public health problem. What are the risk factors for developing breast cancer? Well, obviously, the commonest risk factor is being a woman. It's quite common. About 1 out of 8 women will develop breast cancer in their lifetimes. The other strong risk factor for breast cancer is age. So cancer in general is a disease of older patients. In fact, the median age for developing breast cancer is around 62 or so. So the older you are, the more likely you are to develop breast cancer. There are also other risk factors such as having a strong family history. There are some certain cancers that go along in syndromes, in familial syndromes. So, for instance, if there are multiple first or second degree relatives who have developed breast cancer, particularly developing breast cancer at an early age, or if there are multiple people in the family with ovarian cancer or pancreatic cancer, that's a risk factor for breast cancer as well. Having a genetic predisposition, so having one of the genes that predispose an individual to developing breast cancer, such as the BRCA1, so the BRCA1 or 2 genes, that's a strong risk factor for developing breast cancer. There are also some other genes that are involved. So there's a gene called CHEK2, there is a gene called TP53, and there are really a myriad of other genes that predispose any individual to breast cancer. The other risk factors are excessive consumption of alcohol, obesity, particularly postmenopausal obesity. So if an individual has already gone through the change of life and is obese, that's a risk factor for breast cancer as well. Estrogens, so either endogenous estrogens, so that's estrogens that are made in the body. So for instance, if the body has seen sort of estrogens for a prolonged period, and that comes by having early menarche, so starting one's period at a very early age, say, 9 or 10, and then going through menopause, the change of life, at a very late age, so over 55, 56, 60. So in that situation, the body has had a long time to see estrogens. That's a risk factor for breast cancer. Also, if a woman has gone through the change of life, that sometimes comes with unpleasant symptoms such as night sweats, hot flashes, vaginal dryness, and sometimes women take hormone replacement therapy to increase the level of estrogens to decrease those postmenopausal symptoms. That's a very strong risk factor for breast cancer as well. So these are sort of the risk factors. Most of them, unfortunately, are not able to be modified, such as age, female sex, genetics, but some of them surely can be modified, such as obesity, alcohol, as well as taking hormone replacement therapy to sort of combat the side effects of menopause. So those are sort of some of the risk factors that predispose an individual to developing breast cancer. But again, it's quite common. Most of the time, there's really no risk factor that we can identify other than female sex and age. In terms of prevention, what can an individual do to really reduce the risk of developing breast cancer? So, lifestyle modification, maintaining a healthy weight, exercising at least 3 or 4 times a week, eating a healthy diet, so lots of fruits and vegetables and protein, decreasing refined sugars and carbohydrates, all things in moderation, not taking hormone replacement therapy if possible, or if that is, what must happen to combat the side effects of menopause, then taking the lowest dose necessary and for the shortest time possible. Also, if there is a very strong family history of breast cancer, again, particularly breast or ovarian cancer, particularly in first or second degree relatives, there are actually some pharmacological interventions that can be done to decrease the risk of developing breast cancer. So there are groups of medications that are sort of like anti-estrogens in very simple terms. There are tamoxifen, which is in the group of drugs called selective estrogen receptor modulators. There's tamoxifen, there's raloxifene. There are also a group of drugs that are called aromatase inhibitors, and of those we have 3 commonly prescribed ones, anastrozole, letrozole, and aromacin. All those medications can decrease the risk of developing breast cancer in patients who are very high risk for developing breast cancer. So this is just a quick summary of really introducing what breast cancer is, what the risk factors for breast cancer are, and what an individual can really do to decrease one's risk of breast cancer. At my next talk, maybe later this week or next week, I'll talk about the specific kinds of breast cancers, and then I'll go into a little bit more about management of early stage breast cancer before I tackle management of stage 4 breast cancer. Thank you for listening. Please send any questions in, and I'll be happy to take those questions individually at the next talk as well. Thank you again. This is Dr. Ademoyewa talking about Breast Cancer 101. Thank you.